Aesthetically, I'm known for holistic treatments, natural treatments, and that's basically, I think, what all we preach about and what we like to do. The most stunning person that walks in the room is confident, but looks like themselves. This is the key part of it, not to be somebody else. I'm a strong believer that all these aesthetic treatments we have are simply tools. It's how we apply to the individual. And I always say to doctors, symmetry is not the most important. The most beautiful faces I've ever treated are not symmetrical. Balance, proportion are certainly down there, but I focus a lot on shaping. So I think that's why I'm big on fillers. And then skin quality, and that brings in everything else we do.
Welcome to Inside Aesthetics, the world's most listened to podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, a facial aesthetic doctor, trainer and speaker with over 17 years experience.
And I'm David Siegel, an aesthetic entrepreneur and business mentor who's been working within our industry for over 2 decades. IA is a podcast aimed at educating aesthetic practitioners from around the world. The information contained within our episodes is general in nature and should not be used by the general public to make health or treatment decisions. You should seek the advice of a qualified healthcare professional in your country and have a bespoke consultation.
For our latest news, you can follow us on Instagram and TikTok, and now you can also watch our full episodes on YouTube and Spotify. All of our links are down in the show notes below. Now let's get into today's episode. Hey guys, welcome to another episode of Inside Aesthetics, the world's most listened to podcast for injectors and also cosmetic businesses. As you can see, we're still at the ICCE Conference in Cairo, Egypt with our purpose-built studios. Pretty amazing, David. Is enjoying yourself?
Amazing, great. It's just like a hive of activity. As you said, it feels like we're like commentating a football game.
Yeah.
There's just people out there wandering around. It's a hive of activity. So it's awesome, and getting to talk to lots of international guests that we normally don't get to chat to, and also doing it in person.
Yeah, it's really nice.
we always
were on Zoom.
Yeah, exactly. And so for our next guest, we're talking to Dr. Ishaan Ramkisson, all the way from South Africa. You just gave an amazing talk on, individualized treatments, how to treat people from, I guess, like not so generically, tapping into what makes them them. How do you sort of tap into those features? And then also, we're going to talk about the, GLP-1s as well, which is obviously very popular at the moment. Jake and I have got some differing views on it. I think it's great, but I'd be very interested to hear your perspective on things as well. So thank you for taking the time to join us. I know you're about to fly out to Paris as soon as we finish recording. So thank you for making the time. Very much appreciate it.
Well, thank you guys for having me.
It's our pleasure. Now tell our listeners who haven't come across your work about your background, what you do, and I think you're here with Galderma. So what's your association with them?
So I'm an aesthetic dermatologist, essentially. I'm still practicing in South Africa. I have a clinic in Dubai. I'm one of Galderma's global KOLs, so I help launch their products, do all the training for their doctors. And so Egypt, this is why I'm here, but I was actually invited by the Congress this time, and we're talking about, GLP-1s, the Ozempic sort of faces. These are all the trending topics, but I think aesthetically, I'm known for holistic treatments, natural treatments, and that's basically, I think, what all we preach about and what we like to do.
100%. So how long have you been injecting for?
20 years.
Okay.
20 years, yeah. It'll be 20 years this year.
And who taught you? Where did you learn?
I studied in France, but I look at my people I look up to. I'm friends with Arthur, so anyone, if you're an injector and if you know Arthur Swift will be, but Kundabul, will be there. I think there's a lot of other people that sort of I touched on, but I've developed some of my basic tools of my trade, watching these individuals at IMCAS when there were 300 people attending to the big events that it is now. And certainly I think I'm a forever student, so I don't say I can attribute it to one person. I'm learning from even the people that I am supposed to be training, because they are little pearls that you can learn from everyone and every day.
And what's your practice, primarily made up of? Are you doing a lot of procedural treatments? Are you doing injectables? What's your patient mix?
So I'm about 60-40 in terms of injectables nowadays. Saying that, I'm from South Africa, so I do a lot of skin cancer work.
Yeah, sure.
Sunny, I'm from Durban, South Africa.
Yeah, wow.
Not Cape Town, not Joburg. Durban, this cool place.
On the coast, yeah.
On the coast.
Yep.
And so I still do a lot of acne treatment, skin sensitivity. And as a dermatologist, that's why I think I've got a deep appreciation for regenerative aesthetics, skin quality, all the things that are so-called trending. I've always been there, which is that people are focusing on, which sort of suits me and what I'm doing at the moment.
Who would have guessed that people from Holland moving to Africa would cause skin cancer? But anyway, you would. So when we're talking about holistic care, I mean, we're sort of living in a world now where we've got, amazing aesthetic treatments. We can augment the skin. We can, add shape. We can take away wrinkles. We're now moving into a world where we're looking at regenerative health as well. I know we're going to touch on GLP-1s. What's your thoughts on the regenerative space and, looking at things from a preventative perspective? We've got biostims now, the stem cells out there. Like, where do you kind of see the industry kind of moving, and where does it all fit together?
For me, it's moving all in the right direction because we went through that cookie cutter phase of aesthetics.
Yeah.
And I think
Everyone had the same face.
everyone had the same face. I must have met him one day in Dubai, like about 10 Kim Kardashians on the same day. And for me, I think it detracted from what we really want to do because when you get to deal with all experts in the field, we've always preached natural aesthetics.
Yeah.
And I think move to regenerative, it's sort of the philosophy, we're aging better. I mean, look at the iconic beauties that we see nowadays. What is 50? 50 is the new 30. So this age cancellation phenomenon. So I think everything is in a very positive way. I think the brand of aesthetics that I've always believed in, which is natural, look your authentically best. I come from a country where there's a variable patient group, different ethnicities, different age groups. I think this sort of suits that person. And I think the most stunning person that walks in the room is confident, but looks like themselves. This is the key part of it, not to be somebody else. So I think it's the future, but I also think it's something that some of us have actually been practicing for a while.
Yeah.
And I think it's just that it's not been highlighted the way it is. And I think biostimulation, look, I'm a strong believer that all these aesthetic treatments we have are simply tools. It's how we apply to the individual.
Then you're from the Rainbow Nation, so obviously I'm curious to know what your demographic is. Who are you treating in your clinic?
So look, strangely, a large part of it is still Caucasian because people in a sunny country tend to have photo aging. So we're seeing the wrinkles, sun damage. So they'll present a bit earlier. But I think it's flipped completely because as much as I may talk about, ethnicity differences, I'm seeing a lot of gender differences. I'm seeing a huge amount of men come through. Yeah. And men my age, which are in the 40s, late 40s, they're coming through, they want to treat themselves and it's no more taboo anymore, So men really are focusing. So I think that's the change in the difference that I'm seeing in my group of patients, which is really positive trend.
And how do you kind of start to get a feel for how to aesthetically approach these different ethnic groups, men, when we look at all the marketing paraphernalia and the way that, you guys were trained, it's always around that, middle-aged Caucasian female.
Yeah.
How do you kind of start to educate yourself on what, how to get the best or make someone look like, as you said, themselves?
It's very straightforward for me. I think when you do it for a long time, whoever walks through that door, you already know what you want to do.
Right.
And for me, it all comes down to the basics. It's anatomy. It's what we did at medical school. So the thing to understand beyond that is the skin quality, the texture. So as a dermatologist, I see that. And so I really appreciate those differences. But I treat anatomically, basically. And you can see that we all age in specific fashions. That doesn't necessarily change amongst ethnicities. So we're just trying to move away from the traditional canons of beauty. And I think you have to immerse yourself in the culture from wherever you come from. So I practice in Dubai. And I know that you treat an Emirati different to you treat a Jordanian or Syrian. Yeah. And the same in South Africa. The Black African patient from my city in Durban won't want her lips done. I go to Johannesburg, which is a bit more trendy, modern. I have Black African patients who have beautiful lips who want the lips. So, it's a balancing act of not just ethnicities and where you come from, but really knowing the cultural differences within that society. I see that story sort of is what resonates when you treat ethnicities.
Yeah, I guess one of the dangers for us injectors was we're taught when we're educated that you shouldn't stereotype people, but for example, Asian face versus Caucasian face, it's different. But also you should ask the patient, what do you want? Rather than, I'm just going to treat you like an Asian patient. What does Asian mean? There's so many different types of Asians.
What I think you're saying is so true, that a patient always comes in, they're giving you a complaint. It's the same old medical story. So I follow that. Patient complains and says, I want lips done. And then when you educate them on what their profile is and whether they need it or not, I think that's the key to getting this natural results across everyone.
Yeah.
But I don't think I walk into any consultation with a preconceived area. I can sort of appreciate laxity. I can see bony retrusion. I can see skin quality changes. So I address those things. And when you address the core things that are happening, you sort of build this picture of it's slower, but it certainly looks more natural.
One of the challenges that many injectors have is that they might come in with a specific, indication and what they want to achieve. And I know that many injectors struggle with, well, that's not going to suit your face. Just because it looks good on your friend doesn't mean it's going to look good on you. And being able to take control of that conversation and be able to redirect that process to actually what you, in your professional opinion, what's going to look best. Because I think some injectors have fallen into the role of like order takers rather than actually taking control. So, do you have any advice for people listening on how they can take control of those consultations?
I always tell, my colleagues, just remember you, the doctor, you trained. The patient didn't train. The patient sees a picture, deals with someone in the society or in a friend group. They aspire to be something. And essentially, when they present to you, they are giving you a presenting complaint.
Mm.
We are the ones that train to do all of this. So I think the confidence needs to come from the doctor. And I think I don't have this issue. I'm more than 90% of my consultations is patients from different walks of life walking into my Dubai or South African practice saying to me, you know, I sort of have an idea of who you are. What do you think I have done? It's such a lovely, beautiful conversation. And I don't get somebody who comes in and says, I want my cheekbone done. I want my chin done, you know. People say, I look tired, or you've trained, you're an expert. So that conversation, I think if you set the tone, you need to take it as a doctor, as an injector, the medical part of it. And I really find that even the toughest patients become your most loyal when you take the time to explain to them why.
Yeah.
Because no one else is. Everyone else is just giving them. And that's when it comes down to shopping around. And I have my same patients for 5 to 15 years. So I'm big on retention, you know, and I think it's got to do with that consultation, the initial one, where you set the tone that this is medical, this is the standard we want to keep, and what suits you. And I think I don't deviate from that. It's worked for me.
Yeah, good advice. Now tell us about your symposium that you just did with Galderma, and you're with Professor Cotofano. What were you guys talking about? And give us some snippets.
So I was invited to this symposium, and the topic given to me was the gender blueprint. And basically, it's how to treat the male and female pace, which we've done. And with Sebastian being an anatomist, world class, what we decided to do was to make it exciting. This is the sort of congress where people really want to see the live demo. They don't want to be lectured to too much. So we gave them guiding principles. We had Faraz Hamdan there as an injector from Lebanon. We had Luis Avila from Brazil, a good friend of mine. And so we used essentially Galderma's or Reston portfolio, because that's approved here. And we did, basic injection areas. We went mid-face, we went lower face, jawline. We treated the perioral area holistically. And then we said, this is the gender dimorphism that you get. So there's beautiful presentations, just short. But I think the message was sometimes we have to appreciate the differences so that we don't feminize faces that we don't want to feminize when it comes to men. Yes, there'll be, differences across the world, but this was just guidelines. And that's why I think the topic, calling it the gender blueprint, was quite nice. And it was a beautiful symposium. I think there was the integration of anatomy with rheology, and then also psychology behind treatments that Louise did. And I think this was something that was well received. It was quite a full house. It was really
Can I ask a controversial question? In
may-
this region of the world, maybe gender fluidity may not be accepted as much as maybe some other countries, but do you in your own practice, do you treat sort of patients who are neither wanting to look male or female, but somewhere in between, or that's a conversation?
It's an interesting thing, in my practice, both in Dubai and South Africa, I don't sort of get patients who sort of hint what they sort of want, So I don't get a male asking for to be feminized. I haven't come across that. It's not a common thing.
Okay.
So certainly I treat anatomically, but my patients who've come through, I don't think I've seen as much when I'm with my other international colleagues from other countries, many European countries, sometimes South America. I think they deal more with that sort of request and treatments. But generally, I think where I practice, this is not a common request.
Hey guys, sorry to interrupt your podcast. Just a quick message about our Patreon and how you can support us as a podcast. So David, what is Patreon?
So Patreon is an on-demand subscription service that allows you to access our global community of practitioners, business owners, and essentially it's a place where you can come together, get positive support, advice. Whether you're a beginner or an experienced KOL, there is a place for everybody.
Yeah, so if you download the Patreon app, search for Inside Aesthetics, there are two main options to subscribe. You can become a free member where we can communicate with you, share our news, involve you in competitions, etc. Or you can become a full subscriber for 50 Australian dollars a month. And there you get access to the WhatsApp community where people are sharing and getting advice. But also within the Patreon app, David does a lot of business coaching and mentoring. So I think you've drilled down to various topics that have cropped up that have been communicated in our WhatsApp group.
I mean, just today we recorded some content. It's quite a nuanced space, and the challenges that business owners and practitioners come up against in this space is quite difficult to get advice on. So always happy to share my knowledge and all of my mistakes and lessons learned along the way.
And then I, of course, tackle injectable content. I often involve patients or talk about new products, anatomy, and all that good stuff. So if you like what we do, consider subscribing to our Patreon. Now let's get back into the podcast.
So let's talk about the big one, Ozempic face. We've spoken about it on the podcast a couple of times before. It's this, the GLP-1 phenomenon. It's sort of taking over the world. Everyone's loving it. There's some controversial views around, is it good, is it bad? How much should we be using it? Is it causing, changes to the skin, laxity, collagen stimulation, all that kind of thing? I know you're a big proponent of it. So, what's your thoughts on it? Do you think there's any truth or validity to some of these claims around some of the negative side effects of it? And how do you kind of use it in your practice?
It's a medicine once again. Everything has positive and negatives. And I think we need to understand we're still in the learning curve of how to use it best. I am a proponent of its use. I've seen it change people's lives for the positive. It's given them, some people, just that break or that chance to get their lives on track. I've seen a lot of medical colleagues. I think this is surprising for me that a huge amount of my colleagues on it.
Yeah.
And that tells you that doctors do the research. You know, it's sometimes the stressful lives that we lead and stuff, we're out of shape. It sort of helps you. So I don't see it just being used for aesthetic reasons. Obviously, we spoke about the medical uses beyond it. I'm a dermatologist. I've seen resistant psoriasis patients improve, hidradenitis suppurativa patients improve, a few inflammatory conditions improve. So I think it's a drug that's going to be used more often, and we need to appreciate that it comes with other things.
Yeah.
So we do a lot of talks on biostimulators. We know it does affect skin quality, collagen. We know it affects the dermal white adipose tissue layer. And this is why when we're treating patients, when I have patients who are on these GLP-1 inhibitors, I sort of treat them early. I treat them holistically, and I'm not waiting for them to lose it, because patients don't, considering we're coming in this filler fatigue area, people don't want to be overfilled. They've gone through their GLP-1 phase. They just don't want the GLP-1 face.
Yeah.
So for me, I sort of balance that out with skin quality. It sort of suits me as a dermatologist because I get to speak about things that I'm passionate about why they're dehydrated, why there's laxity. And so I get to use tools like collagen biostimulators, skin boosters, devices. And for me, I think this is a positive step.
Yeah.
I think it, like all medicines, everything's subject to abuse and subject to controversy, and especially in the big media pileup. But I think all in all, as a drug, I see if used correctly, it'll have positive benefits both medically and aesthetically.
Have you found with patients, obviously a lot of them are using it for weight loss rather than medical reasons, and they're scared to add more, in their words, volume to their face. They're trying to lose the weight, and yet if they lose it too quickly in that first 2 or 3 months, they can look quite haggard and gaunt. So how do you explain to your patient that I want to get ahead of that curve and I'm not going to give you volume, I'm just going to improve the skin?
So this has happened to me in a world of treatments where people were being overfilled. So I would treat these patients, and it's the same conversation. I'd say, look, hyaluronic acid fillers are not about volume. You can use them depending on the type, and I'll normally have 2 or 3 different types. So as a demo to a patient, say, look, they all have the same, let's say, company name, but they have different color boxes, different names on each box. Why? Because they all have different properties. I can use it to shape, lift, contour. Yes, I can volumize, but here, I can't create the shape, I can't create the lift without an HA filler, because patients also want the wow effect. They're not necessarily waiting for the collagen biostimulator to kick in. So when I explain how fillers work, and I say doesn't mean filler doesn't equate volume. Once they understand that concept, and if you have a product that has a specific name, I explain how the rheology is, what I'm going to use it for. I do subtle treatments, I do facial shaping because people see the result. They see the lift, they see the projection. Then only I go about treating as, this subtle revolumization. And then suddenly I leave the space for collagen biostimulators. I think this is the popularity of biostimulators at the moment. I use a lot of it beyond the face. I'm doing neck, body areas with it. And I think this is something we're going to see a lot more. So I think we overcome the fear of fillers if we educate patients. Once again, going back to, these are medical tools, medical treatments.
In terms of biostimulators, bioremodelers, like what are your products of choice and sort of, yeah, well, let's go with that.
Well, look, I really like the simplicity of polylactic acid.
PLLA, yeah. Okay.
PLLA, I really like it because it gives me that, it's a subtle result over time. If you get the dilutions right, if you know where you're injecting it and you get the patient quantity right, they get real results. So I think for me, I like PLLA over the other ones. It's easy, accessible, easy to inject. I feel safe as a doctor. I can do combined treatments with it. So for me, that's probably my preferred collagen biostimulator.
Yeah, because some people, we talked about the previous guest saying she doesn't like PLLA because she's, seeing granulomas, and so like, how do you kind of attack that or prevent that problem?
So I've done a masterclass workshop this week going on this. It's often understanding the product and dilution, number one. Number two, the type of injection technique. Are you going to use a needle cannula? Often if you put a needle technique, you're placing all your particles in that bolus. Whereas if you use a cannula, it's like spreading butter on toast. And then you ask the patients to massage the area because it's not like a filler. It doesn't behave like one. So I have not, have that sort of problem. And it was interesting when I did the workshop, there were doctors who told me they've been using PLLA for up to 2 years. And now they understood the difficulty they've been having. It had to do with reconstitution correctly. And number two, simple things like technique. So I think companies make great products.
Yeah.
It's about understanding how to use them correctly. And there's a lot of science behind a lot of these things. And a lot of biostimulators have been on for more than 2 decades. So we've learned from other people's trial and errors. And this is how we can only ever improve.
So I'm guessing you're alluding to Sculptra, that's the brand that
Sculptra?
you're using.
Yeah, I like Sculptra a
So
lot.
what's
It's
your
one of those.
dilution that you're using for face versus neck versus body?
So I'm using a 10 cc dilution, mainly with sterile water and about a ml of Lido for the face area. Anything below the jawline, I'm generally doing between 16 to 20 ml dilutions, which is double. You need larger quantities and you have to select your patients carefully. Not everyone is a candidate for this. I mean, I do my laxity test. I also do the medical test, you know, whether you have autoimmune conditions, all the contraindicatory things, no active inflammation. That's my patient. So I'm comfortable. I obviously, I teach it and I use it a lot, but I do independent workshops. I do things for my Dermatology Society in South Africa on aesthetics where we have different products on. It's still, I think for me, because I've got a good safety and longevity record with it, I like using it.
Do you have any good tips to capture that record of laxity pre-treatment and then post-treatment, like particular angles or poses?
I always tell my colleagues when you use it, remember that it's not a wow effect, it's a build-up. It's like watching grass grow. You put the seedlings in, right? So a patient's not going to look at you and say, wow, you know, they're going to see the water fill up. And I always tell my patients, this is not your results, you know? So when you walk out of this, I always tell probably my colleagues, just be very clear to the patient. And the best way to protect yourself, and I do this with all my first consultations, is I photograph them. I have a little photo booth in my clinic. It's got all black walls. I take a frontal, and the best for laxity is a 45 degrees, because then you can see everything. And then the stretch test, you just pull, you see this, you photograph the patient maybe about 3 months later, 6 months, you see the improvements over time. So I think that's a good thing as a baseline. Often when a patient looks natural, so me even before all of the laxity, why I've always done it is a lot of patients will come back sometimes and you say, oh, I'm not sure I did enough because I'm not sure if I see a result. You look at the before photos like, wow. And I said, you know what? Because I promise you, you look natural. And when you look natural, you forget what you look like at the beginning. So I think in aesthetics, we've got to have those baseline photos. It's simple. It takes you a short few minutes and it's done.
Yeah, without those photos, it's really hard to prove to patients how good they look.
Yes.
But you get that first photo out and they're like, wow, I love it.
Yeah.
But they've only just remembered from the photo.
Recency bias.
Yeah, exactly.
So let's talk about devices for a minute, because that's another part of the equation, right? So we've spoken about, you know, fillers, we've got toxins, you know, using GLP-1s. Devices are advancing all the time. And how,
It's full of them.
yeah, I mean, so how do you sort of balance that out? I mean, because lots of clinics and lots of people listening to this, you know, are starting to integrate skin into their practice. You know, what device to use? How do I sort of use this in my recipe of all the different ingredients I have in my clinic? How do you use devices and balance them when you're holistically treating a patient?
You know, it's the same. It's really the true holistic approach. Often in my country specifically, sun damage is a big thing. So I love IPL devices.
Yeah.
My patients don't tolerate ablative devices
Like a
at
CO2
all.
resurfacing?
Nobody wants to do that in South Africa. They always complain. So I don't invest in that technology. I do a lot of long pulse ND-YAG because I do a lot of rosacea patients.
Yeah.
It's sort of the subtle, you know, skin quality treatment. So it sort of meets my brand of aesthetics, patients with sensitive skin, rosacea, tightening, firming of pores. I do have radiofrequency microneedling devices as well. I think they play a role. I introduced microneedling, a brand name Dermapen to South Africa as a dermatologist years ago. And I use it for acne scarring on darker skin types because I didn't want to use ablative lasers. It worked really well, but nowadays I use needling devices more as a tool to create the entry points for things to go into, like, you know, exosomes, topical treatments, peptides, whatever else.
Yeah.
But devices, I think, yes, they all have a role. We really do like them. We do a lot of, you know, maybe radio frequency as well. I think certain things enhance my injectable portfolio. So if I inject a patient with collagen biostimulators, I enhance it with my devices. So I think it's a balance of whatever is required.
And do you start with skin first, like before you start going to volumizing? Like, do you have a standard process that you go through, or every patient's different?
You know what? I have a treatment plan.
Yep.
Basically, for a patient in aesthetics, I would always say for me, facial shape is key because the wow effects comes from the chin or cheek augmentation because people see it.
Yeah.
And skin quality. There's no point treating, you know, if you have pigmentation, melasma, if you got actinic keratosis, you have rosacea, it's sort of, you can do the best injection techniques and they don't look great.
Yeah.
So I always combine these treatments and I'm very careful, depending on what treatments I'm doing, you can overlap within like 2 weeks, 3 weeks, something else being done. So my patients are always in my practice, they're always in my rooms. And sometimes you look back at it, and when you look at what's been achieved, patients really like it. It's not that they feel they're doing a lot, they're doing little things, but the overall is shape and skin quality, especially when it comes to face. I mean, I always say to doctors, symmetry is not the most important. Most beautiful faces I've ever treated are not symmetrical. Balance proportion are certainly down there, but I focus a lot on shaping. So I think that's why I'm big on fillers. And then skin quality, and that brings in everything else we do.
You mentioned exosomes a moment ago. As a derm, what's your sort of stance on, there's so many brands out there, and I'm sure there's multiple brands here. Like, I'm still a bit confused, if I'm honest. I haven't used them personally yet, but where do you stand?
I've been on a few advisory boards, and I'm waiting for the science to deliver the products. That's I'm gonna leave it there. I think there are a lot of people making things and selling it, but they haven't proven it.
Yes.
And I think that's, for me, is what I'm waiting for. So I don't want to lose out. So I want to be part of the science. I want to see where they're going with this. So that's why I sit on these advisory boards. I think it is coming along, but it's not there. So I think we just have to be really careful and go beyond the marketing that everyone's doing. But will it have a role? I think from the data that we are seeing that's coming through, slowly trickling through, I wish it was quicker. I think there is a place for it.
So you haven't used them yet in your practice?
We have used certain exosomes, and we're seeing skin quality improvements. They're subtle, they're there, but obviously we just need the time frames to see. And split faces are going to be the one that tells me what's doing what,
Yeah. So if we're looking into the future, things are moving so quickly. We've got, artificial intelligence now, and I mean, I can't even imagine where that's going to, take us in terms of, personalized products, and, it's a whole other world. But where do you think like the biggest areas of growth and innovation are coming over the next 5 to 10 years? What excites you the most about the future?
Well, I spoke to someone from one of the magazines a few months ago, and AI-driven things, technology, people are assessing themselves differently.
Yeah.
I did a patient who uploaded her pictures onto ChatGPT and said, what did she need? and quite cleverly, when I was in the clinic, I come through and they said, listen, this patient has done this. She thinks she needs this watch. And I said, don't tell me anything. Can I please assess this lady? I go in there. She's Spanish. She was a former model. She looks great. And so I do subtle things. We end up evaluating what AI projected for this woman. She needed a whole host of things. She needs 7 to 8 mLs of filler. She needed this. I injected her with probably 2.1, 2.2, not even that. And that was distributed all over with skin quality and a toxin. So I think it will come.
Yeah.
I think what I like is that people are expressing their individuality.
Yeah.
So I think that's the future. Is this people want that wholesome, good skin. They want to age better. They're changing their lifestyle around it. So I think it's not just about injectable stuff. You got to look at the holistic. I think we have to look at hormonal health. I have this discussion almost every day with my female patients, and I feel that as injectors now, we need to address that. Otherwise, we sort of putting in treatments, but we need to treat the patient holistically. Men the same. So I think the future is very holistic. It's very regenerative. I think it's very exciting, and we have to be in touch with technology, be in touch with our colleagues, because a lot of people here that I'm friends with, the most amount of information I pick up is before it gets published, having dinner with them.
Yeah.
And that's what I like about events like this.
So Ish, we're obviously at ICCE, we're surrounded by these amazing booths, and like it's pretty busy here, but how would you explain this conference to people who've never been, and maybe how would this reflect on some of the major congresses?
Ooh, one word, manic.
Yeah. Chaos, Manny.
The beauty, I did it last year. And for me, why I came was because they increased the educational content. They had Arthur Swift, Sebastian. I got invited to do workshops. So, when you see those esteemed colleagues, it gives you reassurance. You come here, you're part of the international faculty. And this year, I think if you look at the names, the faculty is amazing. So I'm used to seeing those names on an MCAS, AMWC. So the educational quality is there, but they bridge that gap with social events. They do a phenomenal event with the pyramids at the background, a wonderful gala dinner, concert, and the warmth of the Egyptian, the team is phenomenal. They are phenomenal hosts. And for me, I think I really like the experience. I like the fact that we can all meet. We can meet each other at breakfast. In the evening, there's a chat. It's not so formal, but there is still that academic quality to it. And I think it's improving. I think we almost 10,000 delegates this year. So year on year, they want to get bigger and bigger. And they really are global, I think. It's in Egypt, but it is a global event. So I am really excited to have been part of this from the beginning and to take it to the next level.
Yeah, it's been fantastic for us as well. I couldn't echo your words more.
No, it's funny, you kind of go, it's manic, it feels chaotic, but somehow the last minute, it just all comes together and the magic happens. But it's been great for us. I mean, you know, we're starting to now come to these conferences and, you know, have conversations with people like yourself. So it's been fantastic for us. And as you said, they're like some of the most hospitable, warm people that I've come across. They can't do enough for you.
Yeah. I think as an injector as well, just to walk around and like literally see different people, different faces, different cultures, it makes you rethink what you thought you knew as an injector about how you're going to approach a patient, have a conversation. So I just think it's fascinating.
Yeah, fantastic.
Great. Well, thank you so much for your time. We really appreciate it. I know you got a flight to get to.
Oh yes,
But,
next city.
yeah,
we'll
next
hopefully
continent.
see you next year at ICCE again.
Thank you.
Thank you
very
for
much.
having me.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more.
All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.